Welcome to Season 4 of the Lighting Your Way podcast. This season, we will hear from all types of guests who share their experiences, their insights, and their personal stories. In recent weeks, physicians and hospitals across the country have reported seeing more cases of the respiratory syncytial virus, or RSV. Pediatric hospitals like Children's National in Washington, D.C., Children's Hospital of Philadelphia, and Children's Medical Center in Hartford, Connecticut, are all reporting unusually high numbers of admissions for respiratory illnesses. RSV is a common respiratory virus among children that produces common cold symptoms. For most, a mild case of RSV lasts about 2 weeks. But some infants, young children, and older adults, especially those with pre-existing health conditions, may suffer from more severe cases. In this week's episode, I am joined by two of my colleagues at Guardian Nurses, Walker LeFleur and Bianca Pollart. Both Bianca and Walker are nurses as well as parents of young children. We talk about RSV, what it is, how to try to prevent getting it, and what to do if your child does get sick with RSV. Welcome to the podcast, Bianca and Walker. Good to have you.
Thank you so much, Betty, for having me. I appreciate it. I'm excited to be here.
Thank you. Walker?
Thank you, Betty, as well. I'm excited to be here on the podcast.
Yeah, the topic today for the podcast, this episode, is respiratory syncytial virus, or in the common language, RSV, V for virus. And that is, we're taping this in October, and we have seen across the United States an increase in children who are getting the RSV virus. And we thought that it would be a timely podcast to include this topic. So Bianca, you're a pediatric nurse and have young children. Walker, you have young children. You're a nurse with us out in Seattle. So I thought it'd be helpful to have you guys on the podcast and talk about it. So let's start with the easy question, maybe. Bianca, what is RSV?
So RSV is a common respiratory virus that's usually mild and gives cold-like symptoms. But when it becomes tricky is when the infant is younger than 1. It can cause bronchiolitis, which is inflammation in the small airways of the lungs, as well as pneumonia, which is an infection in the lungs. So anyone can get this, but it's very dangerous for children under 1.
So when you say anyone can get it, adults can get it as well.
Yeah, so it's just like a common virus that like you or I would get, that we can deal with it at home, kind of manage the symptoms. But because these children are so young, their lungs are underdeveloped, we become concerned at that point in breathing, them eating, staying hydrated, and so forth.
That makes sense. And Walker, as I mentioned, we've heard that RSV has started early this year. I'm assuming that's done in Seattle as well as on the East Coast. What does that mean? I mean, what does early mean?
Yeah, as you know, early mean that it occurs late fall through early spring months, which, you know, with younger children, as the temperature change, you know, they can start experiencing runny nose and coughing. So definitely look for late fall and early spring. That's when this virus is mostly active. And throughout the couple of years past, especially with COVID, where you had everybody was staying home and the kids was wearing masks. So now as everybody starts to take off their masks, you get an increase of viruses that, like RSV, who's running rampant on our communities. So we definitely, you know, want to tell everybody in the house and your family to, you know, wash their hands, you know, stay away from multi-surfaces, like touching multi-surfaces, and just kind of do a general cleaning for your house and your homes, especially for parents who send their kids to daycares and early learning centers. For myself, I have a 4-year-old daughter who just started early learning daycare. So she contacted RSV through just being around other children. This is the first year she started early learning, and that's my experience, my wife and I experience with RSV and with our daughter.
When did your daughter Ellie contract RSV? Was it this year or last year?
Yeah, she actually contacted early October this year when she started daycare, early learning.
Wow. Okay. So we'll get back to that. I think you make a good point. The fact that we've all been masked for the last couple of years, and that includes the young children, and they didn't have the opportunity perhaps to develop their immune system as perhaps we would have in COVID. Bianca, let me get back to you as the peds nurse. Does RSV affect older kids? I mean, we're talking about young children whose lungs are perhaps not developed, but does it affect older kids and babies the same way?
Definitely not in the same way, but to answer your question, yes, it does. It does affect older children, but it becomes, for a child under 6 months, you're going to look for the common symptoms that we can cite, such as a runny nose, decrease in appetite, and a cough, as well as wheezing. It's just hard when these babies have no reserve and their lungs are so underdeveloped.
Okay, and I'm assuming that because this is a virus, it cannot be treated with with antibiotics. Is that true?
You are correct. Yep, it is a virus, so we don't treat viral infections with antibiotics.
So a lot of parents, I'm sure, they don't want to see their child suffering and, sneezing and coughing. So in your experience, in your practice, was that a common request to get antibiotics?
It was, yes. I mean, an IV antibiotic is what a lot of people would request for their child just to get them better over this hump quickly. But unfortunately, as well as other measures that you can take in the hospital, such as giving an IV fluids, as well as respiratory support, the only thing that truly does help is time.
Okay. So, and time with the children who come to the ER, say at Children's Hospital of Philadelphia, and they're admitted, is that because their respiratory status is pretty compromised?
Yes, it is. Yes, very compromised. So they would need respiratory support, IV fluids, because they're unable to keep any of their bottles down just because all of the congestion they have in their lungs.
Okay.
So those are like two common things that we need to help with.
And how long, in terms of how long the RSV virus, how long the baby and the child is symptomatic? I mean, how does that, is it a week? What do you think about timing?
So it usually peaks about day 5. So I always tell parents to, kind of think back when your child had their first runny nose. What day was that? So if you say that was last Thursday and today's Saturday, you would know you're on day 3. So usually by Monday, you see the virus peak, and it kind of is like a mountain. It trends up and then it trends down very slowly. So it can be a week, it can be a couple of days, but it all depends on every child.
Yeah, I guess, right. Everybody's different.
Yeah, it can truly last longer than a week as well.
So, in an infant less than 6 months, I mean, Walker, we'll get to you with Ellie, but in an infant less than 6 months, and Bianca, I know your son is 9 months old, but what symptoms should a parent look for if they have an infant that's less than 6 months old?
Yeah, so you should look for a cough, any wheezing that you might hear, or crackles, you can usually hear them without a stethoscope. So you can see your baby wheezing, struggling to breathe. You can also look for retractions, which is just pulling by the rib cage. And then you also want to start to count their diapers and how much formula or breast milk they're taking in as well, because it's a general rule of thumb. If you have RSV, it's normal for them to drink about 40 to 50% of their feeding, but anything less is really cause for concern.
Okay.
And then keep in mind, irritation is common with these babies just because they're not getting their caloric needs, as well as they're struggling to breathe as well. So they become irritated, fussy, and just need those extra loving and cuddles.
Okay. How about, do they run a temperature typically?
They do, yes. They also run a temperature. So a temperature of 100.4 rectally needs to be seen by your pediatrician.
Okay.
At the
And
very
during this RSV season, is it? I think I know what the answer is going to be. But when you call your pediatrician and say, that you think your baby has RSV, are they apt to get you in quicker? Like, are they apt to see you?
Yes, of course. Yeah, they should get you in very quickly. A same-day appointment is very important, as well as within the next couple hours. And if you can't get into your pediatrician, an ER visit or urgent care is definitely warranted.
Okay. Walker, so with Ellie, who was 4, so clearly above 6 months, what symptoms should parents look for RSV?
I think parents should really look for, some of the classic symptoms. Some of the symptoms that we saw with Ellie was she had the runny nose. She actually had the runny nose for about 2 days or so. We were just monitoring it. And then you want to also look for coughing. And she was really coughing. It's not just a regular coughing, it's a deep cough. The type of cough that, as a parent, that really gets you worry a little bit. And then that can also progress to wheezing, and to the point where, it can cause them to breathe through their mouth, and that retractive belly breathing for a child. That should really get a parent to contact their pediatrician. And we did that. At first, we was treating her at home, as I am a nurse. My wife is also a nurse as well. So we knew exactly what to do. But, parents should really look for these signs. Again, like Bianca said, a loss of appetite. If your kid is not eating like they used to, you need to pay attention to that. And also, lack of energy. I also noticed that she wasn't playing as much as she used to. And then, after on the 3rd, 4th day, we definitely rushed her into the urgent care, and they was able to see us the same day, where the pediatrician actually told us that because we did some of the at-home remedies, basic remedies, that really helped her to get better. And they prescribed her a medication that's called albuterol, which also helped clear the lungs, the airway, so which allowed her to get better. And she actually got better after, I'll say on the 5th day, she got better.
So Ellie was not hospitalized?
No, she was not hospitalized.
Okay, great. And how did you protect, in terms of protecting the twins, because they're 13 years old, how did you make sure that they didn't contract it?
We basically had her quarantined in our room, and while the twins was in their own room. So as parents, she wanted to be with us, and it was easier for us to take care of her. We knew exactly what to do. But for the twins, we completely kept them away from Ellie.
Okay, great. So Walker has quarantined Ellie, right? And how is RSV transmitted?
So RSV is transmitted through droplets. So the virus can land on a hard surface, such as a table, a doorknob, or curb rail, And because RSV is transmitted so quickly, this is why you see people on social media talking about not kissing a baby that's not yours, as cute as they are, try to really not touch their face, kiss them as well. Even their hands, honestly, because they're going to put their hands in their mouth as well.
Right.
And people can get infected with RSV because they're contagious for 3 to 8 days.
So an infant or a child can give it to an adult. This is not just child to child or infant to infant contact, right?
Correct, but it's a common cold in adults.
Right. Okay. So is there, so if you were to call the pediatrician, and you show up at their office, how do they test for RSV, Bianca?
So they can do a simple nasal swab similar to the COVID test that we've all been having to do the past couple of years. But again, it's a different test, but similar to that. And then you can also do a chest X-ray or oxygen saturation test if you're causing for the concern for lung congestion.
Okay. And Walker, let's go back to your house. So you quarantined Ellie from the twins, and you and your wife were both nurses. Did you get sick? I mean, what did you do to prevent transmission to you?
Well, for me, I did not get sick. You know, I was taking my multivitamins. I usually try to get my workout and as much as I can. My wife did actually contacted, I wouldn't say RSV, but she did get the common cold.
Oh, so your wife got it.
Yeah.
Oh, wow. And how long was she sick from the cold?
She was sick about a week or so.
The joys of passing viruses back and forth. So Bianca, you were a peds nurse, right? Before you came to Guardian Nurses, and Bo was born 9 months ago in kind of the height of COVID. It was January of 2022, so we had a lot of waxes and wanes. But what did you do when Bo was born? Because you had small children at home as well.
Yeah, so we had small children. Both of my 2 older children were actually in school. So a common practice that we have in our house is during these months, they need to take their shoes and their clothes off before they come in the house and touch the baby, as well as frequent hand washing. So when they came home from school, they would take their school clothes off, take their shoes off, wash their hands, change their clothes before they were ever allowed near myself or the baby. And that worked out well for us. We generally stayed healthy throughout the months, the winter months last year, as well as spring. And so far this year, not good.
Are your kids, so I guess your 6-year-old is he in school?
Yes, she's in first grade.
Oh, she's in first grade. Okay. So and the twins, so Walker, both of you have children that are school age, right? That are going into school. Are you hearing more about children in their classes getting RSV?
Yes, absolutely. I'm hearing it from my older twins, which are 13. They're in middle school, and they often come home and say, hey, there's a lot of sick kids at school. So, we teach them to do some of the common stuff, right? Stay far distance from other kids who are sick, and also wash their hands. I think that's the number one, is when they come home, they'll take their shoes off in the garage and then come in and wash their hands before interacting with Ellie.
Okay. Yeah, it's you'd hope that they wouldn't be in school if they were sick. That parents would keep them home, but I guess when they're just starting to have symptoms, I guess they're there not wanting to miss school. Bianca, how about you for your daughter?
Yeah, we're definitely seeing an increase in the colds around us here. In fact, my daughter's had a runny nose and cough for quite some time right now, but it's kind of circulating through the school in our areas. But like Walker said, we promote frequent hand washing. Coughing into inside of your elbow also helps. I think it's a good practice to teach the young ones to do that.
That's a good suggestion. Yeah.
Especially because it is droplet, so it will land on contact surfaces. So coughing or sneezing inside your elbow also helps teach them good preventative matters.
Is there any Bianca? Is there any vaccine? We've heard a lot about the COVID vaccines, and certainly kids are lined up for other vaccines in their lifetime. But is there any vaccine for RSV?
Unfortunately, there's not, but healthcare providers usually give a medication to premature infants and young children with certain heart and lung conditions to help prevent RSV during the early months.
Just because they're premature and their lungs probably are less resistant, right?
Yes, of course, that's exactly it.
Okay.
They're underdeveloped, less resistant.
So if folks have questions about their infants or their child's symptoms, what should they do, Walker?
Well, they can ask their medical professionals. There is 6 common questions that I think would be very important for them to ask. Number 1 is, does RSV affect older children and babies the same way? And then number 2, can RSV be treated with antibiotics, which Bianca went over?
Right.
Number 3 would be, how long will my child have this cough and congestion for? And number 4, will diluting formula help my baby drink more?
Okay.
And number 5 is RSV the only virus that can cause bronchitis? And then number 6 is, when should I take my child to the doctor versus the emergency department?
Okay. Is it, I guess the question that we hear about emergency department, Bianca, you mentioned urgent care. Should they just bypass urgent care and go right to the ER? Feels like at that point there might be more of an urgency and get to the ER rather than kind of make a middle stop at urgent care.
Yeah, of course. So something to note when your child's breathing rapidly or there's any retractions, which is sinking between the ribs, that definitely warrants an emergency room visit or to call 911 at home, as well as having episodes of apnea. And that's when your child stops breathing for a period of time.
Ooh.
That certainly requires you to call 911. And then if he or she, your child, is having episodes of turning blue, that's definitely a reason to get right to the ER instead of your pediatrician or urgent care.
Definitely. And let's just say any ER, right? Not just the pediatric hospital's ER.
Yeah, of course, your closest ER is the ideal.
Okay. So I hope that these are kind of pragmatic questions and answers. I think it might be helpful for parents to understand, that RSV is essentially, a virus, as you said, Bianca, that it can't be treated with antibiotics. Is there anything that either of you would like to conclude on? Is there anything that we haven't mentioned or anything that I haven't asked that you think we should include? Walker, how about you go first?
Yes. Earlier, I mentioned that we was actually treating Ellie at home with some home remedies. They are actually pediatrician recommended remedies. So the first one we did, we used a Vicks warm steam vaporizer humidifier.
Okay. Yeah.
And you can find it in any local CVS, Walgreens, Rite Aid. And what it does, it's a humidifier where you add water and you add a little bit of salt, and then that produces a vapor. And when that vapor is in the room, it allows to help loosen up whatever mucus and open up the lungs a little bit.
Okay.
And then the second one I would definitely recommend. It's called a nose Freda. And what that is, if you can imagine a straw, it's kind of like a straw where there is a rubber piece that goes into the parent's mouth, and then there's also another piece that goes into the baby's mouth. So what it do is you can actually suck the snot out of the baby's nose, which I know it sounds nasty, but there is a
That
mechanism.
that is love. I'll say that is love. That is pure love.
Hey, when your child is sick, you would do whatever it takes for them to get better. And so it sucks the snot out, and which allows the airway and the nasal cavity to open up so the baby can breathe a little bit better. So my wife and I actually did that for 2 days, and that really, really helped Ellie to get better very quickly on the 5th day. So I would definitely recommend those two products.
Those are great. Okay, great. Thank you. Bianca, how about you? Anything that we haven't covered or you'd like to close on?
So Walker, I think that was great. And I think it's also important to remember for these babies, suctioning before any feed, just so that it makes it easier for them and they can keep this nutrition down. I think it's very important to note that. And I also think it's important to really have a good relationship with your pediatrician and be able to ask these questions and get in there really quickly and to keep an open relationship with them. So, when these things arise, any questions, not a silly question, and you can get right in there or even call your nurse line at your pediatrician.
Those are great suggestions. Thank you both for those. Walker, I will not be able to get that image out of my head of you and. Thank you for that. Thank you both for joining me. I think this was helpful. I certainly learned some stuff, not being a pediatric nurse. So thank you both for joining me. And I hope that you and your families and children stay healthy this RSV season.
Thank you, Betty. It was a pleasure being here.
Thank you.
Thank you,
Walker.
Thank you.
Yeah, take care and tell Ellie I said hi.
Thank you, Betty. It's a pleasure. Be safe out there.
Okay, bye-bye.
Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, Google, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.